on the video. And
Got it.
all right. And I am going to start with the audio. Sorry, I had a cold like 2.5 weeks ago, and I still feel like I'm always clearing my chest. So let me make sure that's okay before I start. Have my water. All right. In 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have Dr. Alan J. Bauman. He is a full-time hair transplant surgeon who founded his medical practice, Bauman Medical, in Boca Raton, Florida, in 1997 and has treated nearly 30,000 patients and performed over 10,000 hair transplant procedures to date. Dr. Bauman is one of only approximately 200 physicians worldwide to achieve certification from the esteemed American and International Board of Hair Restoration Surgery, and to be an accepted member of the elite International Alliance of Hair Restoration Surgeons, and also recommended by the American Hair Loss Association. Dr. Bauman, he actually has many more accolades and credentials, and probably too many to even name here, but I will have all of his information in my podcast description. So I will also say this conversation is going to be a little bit different because Dr. Bauman does things differently. And I was fortunate enough that we got to meet in person last year in Miami, and it was awesome. And I learned so much from him. And so now with that, let's welcome Dr. Bauman to the show. Thank you for coming again.
Thanks, Sandy. Thank you so much for having me. It's great to see you again. And I really enjoyed that conference. It was great to meet you there in Miami.
It was great. And I actually did a few fun things at your booth, but I guess we'll get into that. I think it's important to first talk about how you got into this entire hair restoration line of work.
Yeah, well, it goes back pretty far, actually. A lot of people want to know when I decided to become a doctor. And if you asked my grandmother, who's since passed away, she would have said something like, the day he was born. So it was kind of preordained that I was going to basically go to medical school. And but I had the unique opportunity when I was a teenager to be mentored by a very prominent plastic surgeon in Manhattan. I grew up in New Jersey, and I remember before I could even drive a car, my dad drove me into the city, and I met this friend of the family who took me into the OR and told me where to stand, what scrubs to wear, and all that. And I watched procedures that he performed that day, and it was amazing to see his artistic hands using surgical skill to basically change people's lives for the better using cosmetic and reconstructive surgery. And I knew at that moment that that's really, really what I wanted to do. And I kept my mind open, kept an open mind through the training and so forth. But even all through medical school and my internship and residency, I always thought that that's what I was going to do, change people's lives through through surgical skill. But it wasn't until I was in my surgical residency did I have the opportunity to see and meet a hair transplant patient. And the weird thing is that I didn't even really know or realize that he was a hair transplant patient until he told me in his medical history that he had had a procedure done. And back in the 1990s, I guess, like everybody else, I thought hair transplants were kind of pluggy and weird. And like, why
Yeah.
would you ever do that? And so I was basically blown away by this patient's results, which were right there in front of me, because it looked 100% natural. And we got into this casual conversation about the procedure and the technology at that time, which was becoming a lot more microsurgical. And the other thing that I recall from meeting that patient was how he described the hair restoration changed his life. And so socially and professionally, his life was altered from that point forward. And so I thought to myself, well, gosh, this plastic surgery thing is going to be amazing. Maybe I should also take a look at this hair transplant stuff. I don't really know much about it. And so that began my journey of education, and there wasn't really a lot of info out there. There were a couple of textbooks, journals, things like that. I really had to go and meet people. I really had to go to different conferences to meet surgeons and actually go and visit surgeons around the country to understand how modern hair transplant was being executed. How was single follicle implantation and artistic design creating something that looked 100% natural and undetectable. And so, over the time in that phase, when I was doing my internship and residency in surgery, thinking about plastic surgery, that's where I took some extra time to basically be mentored by a hair transplant surgeon. And after that bit of time, it was about a year or so that I took off from my surgical residency. I decided not to go back to plastic surgery, and I decided to focus 100% on hair. I was super excited about it, and it just seemed like this is what I was born and made to do. So that was, over 25 years ago. So I moved to Boca Raton, Florida with my wife. At the time we were engaged. We packed the car and the belongings and my cat and everything, and moved to Boca, and I opened the practice with 1,000 square feet, with no employees and no referral sources or anything, just kind of a hope and a dream that we would start to begin to change lives with this new surgical skill that I had acquired. And, since then, my parents say it's been a 25-year overnight success.
Well, first off, I'm going to say you're dating yourself a little bit, because I'm like, you don't look like you've been in the industry for that long, right? So, I mean, that's a testament to your youthfulness and keeping that youthful appearance. But I'm going to say you also do things differently. And I know this because you and I met last year. So I think it's important to maybe begin with why does hair loss happen? We know that genetics are obviously part of it. And we hear all these like stories, oh, you take after your mom's father, and maybe break down the genetics for us first.
Sure. Well, first of all, just on your comment on being in the industry for 25 years, yeah, it's gone pretty quick. It does seem like it's just been a blink of an eye. And, I have an amazing team and a 12,000 square foot facility today with over 30 team members. And as you said in the intro, we've treated tens of thousands of patients and performed, over 12,000 surgeries and so forth. So it's been a pretty exciting ride, but we still have a lot of fun doing what we do. And of course, that my hobby is longevity and health and wellness. So I would say, practice what I preach on that. And just in the same way that I treat my patients with a holistic approach, it's not just with the, psychiatry with a knife, just with the hair transplant procedure, but we really try to get to the basis of what's causing or accelerating their hair loss. And so that brings us to the other part of your question, which is what's going on out there with all this hair loss situation. So I mean, obviously, the background is always based in genetics. And we know specifically in men that hair loss is genetic and passed along through the mom's side or the dad's side of the family or both. And that what you inherit is a sensitivity to DHT, which is dihydrotestosterone. That's a metabolite of the testosterone, the male hormone. And in women, you can also be sensitive to DHT, but there's a lot of other things that can dysregulate the hair follicle. And gosh, you can imagine stress, sleep-wake cycle dysregulation, nutrition, inflammation in the body. All of these different things can absolutely affect the hair follicle. So in our examination, let's say, or discovery process with each and every patient, we spend a lot of time talking about what their social situation is, what their metabolic situation is, what's their lifestyle, and all these other things that are also contributing to that underlying genetic tendency, perhaps, to lose hair. And so, and of course, men and women, nobody wants to lose their hair. This is something that you're born with. It's a sign of youth and vitality. And as humans, we're hardwired to want to look good and feel good about it. Because remember that hair loss is like a biologic clock that's visible from across the room. So evolutionarily, we're certainly hardwired to want to choose a good mate and propagate the species. And our lizard brain is hardwired to do that, to make a snap judgment of whether this person's going to be a good mate or not. And hair is one of those things that's important. It frames the face in a youthful way, a full, thick, and healthy head of hair is something that's very, very desirable. And you don't have to go back to the personal pages in the 1980s and 90s to know that, men and women were looking, for guys with hair. That was important. And so today it's a swipe right or swipe left, I guess. But the
Yeah.
point is that hair is very desirable because it is an important sign of youth and vitality. And
Yeah.
that's why people want it. And when you start to see that whether it's your skin or your body starts to change in a way that you're not liking it, that's revealing, let's say, your age or showing your age, and hair is certainly a big part of that. It's normal and okay to want to do something about that. And so I
Yes.
think that's probably the most important thing for your followers to understand, that it's not like, oh my God, you're so vain, you want your hair back. Well, no, it's like you had your hair. That's like somebody, like your arm fell off. You want your arm back. Hair is usually a part of you, and it's a very important sign of self-expression. And so as humans, we're very emotionally wired to our hair. And some people embrace hair loss. Certainly if you're going to, rock it like Dwayne the Rock Johnson, that's all fine and
Sure.
good. But, or Sinead O'Connor, on the female side of things. But anyway, the point is that hair is important, and it's okay to want to keep it and enhance it and beautify it and restore it. And that's what we do for patients day in and day out.
Yeah, I think that we're living in an era now whereby it's not something to be embarrassed about or to hide. Women and men alike openly talk about doing Botox and doing skin treatments and it used to be so hush hush. And Alan, I am very transparent. Like, I'm not going to go out and scream to the world everything that I do. But if somebody asks me, I'm certainly not ashamed to say what I'm doing. And I think
Right.
that hair loss traditionally has always been this, the guy goes away for a little bit. He wears the hat for a very long time and hides it and makes sure. And I'm like, that needs to change, because I'm with you. I think for men, women alike, you gotta do what provides you with that youthfulness inside. And then, of course, do all the other stuff too. So you do a lot of testing there, right? To see
Sure.
why the hair loss is happening. Because I want to make this clear, even for the women out there, this happens to women all the time. Hair starts to thin. There's issues that could be relating to hormonal issues. Like, I know, for
Absolutely.
me, having no thyroid, I've gone through situations whereby I become very hypothyroid, and giant clumps of hair in my brush is not a fun feeling. And I'm a woman. So you treat both men and women of all ages. So maybe start with what you do differently from any other hair restoration expert.
Yeah. So from the very beginning of my practice, we always had a lot of women come through the practice for evaluations and treatments. And what was interesting is that my colleagues hardly ever treated any women. Back in the 1990s, it was like 90-10, mostly men, 10% women. But what I saw in my practice is that women were flocking to find out what was going on. And so it was up to me to try to figure this out. What is happening? So, of course, as you described, hormonal changes are really important. A lot of times women will see hair shedding, for example, after childbirth. And of course, the hormones are raging at full tilt during pregnancy. And then immediately after childbirth, boom, they're crashing. And 6 weeks later, they could be shedding. And sometimes that shedding is short lived and things regrow and it's all fine and good. But in other times, it reveals this underlying tendency towards female pattern hair loss, which of course looks different than male pattern hair loss. In men, you could see across the room, the hairlines are receding, they got a little bald spot in the
Yeah.
back. In women, it really just degrades the density in the frontal zone and the temple areas, almost imperceptibly at first to the naked eye, but you're feeling the difference. You might be seeing the shedding. Your hair texture might be changing. Certainly that ponytail volume might be decreasing. If you're seeing more hair in the shower, in the brush, that may be a sign that something's going on. So as those hormones change through life, whether it be childbirth, perimenopause, menopause, or as you mentioned, thyroid and other hormones, hair follicles are very, very sensitive to changes in hormones and other things too, even cortisol. So as you are experiencing a global pandemic, a lockdown, you're stressed out, you're not sleeping well. All of that is going to raise your cortisol levels because under the perceived stress, your body is gearing up to fight or flee from the situation. And the excess cortisol shuts down follicles in a big way. So I've seen over the past few years an unbelievable explosion of hair loss in both men and women, and an acceleration of that natural male or female pattern hair loss process that is revealing a lot of thinning and shedding and scalp shining through. And it's, again, not just being sick with COVID, but again, the stress of the lockdowns or even the vaccination, which seems
Yeah.
to dysregulate the immune system as well as the microcirculation in many cases. We're seeing issues with strokes and clots and things like that,
Yes.
heart problems. That's very, very well documented now as this thing has been rolled out to so many people. And I've had patients with autoimmune hair loss. So autoimmune hair loss looks a little bit different than female pattern hair loss. Usually you'll get a round circular zone or patch of hair that will shed out due to autoimmune conditions. And that can be something that can be as simple as a reaction to something you're in your environment or something that you've eaten, or again, that level of stress or lack of sleep in your lifestyle factors that can trigger that autoimmune system to kind of ramp up and fight the follicles, unfortunately. But most of the patients that we see in the practice have some hereditary component and then these exacerbations from their metabolic system or lifestyle. Oh,
So,
and of course, today, Ozempic and Wegovy, all of these, the GLP-1 agonists that people are using for diabetes or to lose weight is creating a whole nother, I hate the word pandemic, but a whole nother situation of hair loss in a massive amount of people. I mean, you can't even, it's hard to get the drug here in Florida. Even
yeah.
the diabetics are having a hard time. There's so many people on it for weight loss, but that can certainly, due to nutritional deficiencies, if you're not feeding yourself enough protein while you're losing the weight, you can lose hair at the same time. And that I've seen so much of that. It's unbelievable.
Yeah, that's so interesting because I've heard actually a lot of not so great things about being on that drug for a long period of time. I mean, I'm sure it helps a lot of people, but then there's also some fallback when you, I guess, some symptoms that you experience when you try and get off too. I didn't know
Mm.
that hair loss, but that makes sense because nutritional deficiencies, not eating enough protein, absolutely, you're not getting the amino acids. So do you actually do gut testing and everything there?
Yeah, so we do gut testing, nutrigenomics. We do genetic
Okay.
testing. I have a full time nurse practitioner who is trained in functional medicine and endocrinology. He is a great friend of mine. We've known each other through the American Academy of Anti-Aging for many, many years, and I was finally able to convince him to come down from the Northeast of the U.S. here to Florida with us. So it's a bit of a new project for us, but we've always had even my existing nurse practitioner who's helped me sort through these things to figure out really what's going on. Now, we're not your primary doctor by
Right.
any stretch of the imagination, but we will uncover things because we do extensive blood work in most patients if the symptoms reveal. And we're seeing also a lot of patients, like I said, who are on a weight loss regimen. They may have been on a restrictive diet, vegan, vegetarian, where they didn't realize that they were missing essential nutrients and literally fuel, uh, you know, and then the other folks who are on maybe medications. And so patients who are on blood pressure medications, mood modulators, cholesterol drugs can all affect your hair. And then, as we mentioned, the weight loss medications, the GLP-1 agonists certainly can do that. And also hormone replacement in some cases. So, for example, if you're
Oh,
doing hormone optimization as a man or a woman, and you're using some testosterone, because it turns into that DHT, which is dihydrotestosterone, the androgen, if you're super sensitive to that in your hair, you can trigger some hair loss. And so I like to think that we're doing the things that can optimize your hormones, but also protect your hair. And
uh,
if you want to lose weight, no problem. We can help you lose weight, but also protect your hair. We can get you to be thinner and your hair to get thicker. And that's sometimes missed in these other practices that you see out there that are not specializing in hair. And so, gosh, what good is it to lose all that weight and then you lose your hair at the same time? That's not a great idea. I don't
Oh,
think I would be
no.
hating that.
Wow.
Yeah.
Okay. Yeah, that is huge because I don't think people realize, and I'm a nutritionist, so I'm going to say food is medicine. So
Yeah.
if food is medicine and you're not taking your medicine, your medication, quote unquote, then
Right.
you're not going to do the body good if you need it. And we need food.
Right.
So,
Sure.
that's really, really important to note.
Yeah, and we've learned this. I mean, my background in general surgery, I certainly saw a lot of bariatric patients in the 1990s as that technology came available. And, bariatric patients, people who have had weight loss surgery, tend to lose a lot of weight pretty rapidly.
Yeah.
And so that, years ago, that kind of prepared us for where we are today with this new realm of weight loss drugs, which are kind of mimicking that rapid weight loss in many patients. And so, as a nutritionist, I'm sure you can agree that all of that needs to be done in a careful way.
Mm-hmm.
Um, and there's some also other new modalities that we can employ to help those patients maintain muscle mass, maintain bone density while they're in the weight loss program and growing their hair. And so, whether that's hormone optimization with peptides and things like that that can really enhance hair growth and maintain muscle mass. I think that's really, really important. And a lot of folks do seek us out because we're kind of known for that.
Yeah. You also have incredible technology that you use to see what's going on. And I know I actually have a video. I'm going to have to post that
Got it.
because I actually had one of those what was it? It was like photography. You're going to obviously explain it, but you
Right.
checked to see if I was having less hair density in certain areas. And then,
Sure.
yeah,
Think about, okay, when no matter what kind of health issue you're having, your caregiver, your physician should do a history, and that's what we just talked about, elucidating what's going on
yeah,
with the lifestyle factors, risk factors like have you had plastic surgery or other surgery in the past, have you had a brow lift, a facelift, those things can cause changes to the hairline and density and so forth. So what medications are you on? Oh, that's the history, right? But then there's the physical exam. And so traditionally the physical exam from your dermatologist is looking at you from across the room and going, you got plenty of hair. We'll see you later. Come on back
yeah,
when you're bald, right? So that's not kosher. That in my book, that's like, first of all, that's terrible. It's degrading and it's disrespectful
yeah.
because a woman who comes in and says that she notices that her ponytail is thinner, 99.9999% of the time, she's not lying. She knows because
Yes.
women take inventory of their hair like 12 times a day. And I think that there's some science behind that, whether you're touching it, feeling it, braiding it, managing it, coloring it, styling it, much more than men with a crew cut, right? You guys are inventorying your hair multiple
Totally.
times a day. So I learned very early to believe the women that they're not lying to you.
In more
They
ways
may look
than
like they
one.
yeah, they may look like they have got a head of hair. It's not like male pattern baldness, but there's something going on. So we need to look more closely. So thank God. I mean, this is in 2001 or whatever. I got the first video microscope for the scalp. It came from Paris, France. It was called the Capillicare. News organizations came from as far away as Boston to fly down to Miami to actually video me using this tool, which was brand new here in the United States. But anyway, the point is that so many years later, here we are, over 20 years later, we have an AI powered microscope that literally takes pictures of different areas of your scalp, compares the good areas to the weaker zones, not only in terms of density, how much hair there physically is per square inch or square centimeter, but also the quality of the hair. So it measures, is your hair super fine and short? Is it medium thin, or is it medium thick, or is it super thick? And every hair is actually tracked on your scalp. We have tools that enable us to actually track every individual hair over time, like a virtual tattoo. And that's even newer technology than what you saw at the conference
Very cool.
last year. So why would we do all of this? Well, the importance is to get a baseline measurement to compare the best areas, which would typically be the back of your scalp, unless you've mistreated it with hair extensions or something like that, and compare that to other areas that are typically going to be thinning. And especially in women, it's going to be the front and center. In
Yeah.
men, obviously, it's the crown or the temples, but we'll compare those areas and see what is the current status. And the reason why that's so important is because you can lose 50% of your hair density without it being noticeable to the naked eye. That means on a photo, in the mirror, to your friends, you look the same, but the density is 50% of what it was previously. So we need to identify if there's 30% loss, 35% loss, because that's going to tell us what's happened over the past 10 years. And we need to fix it and halt that process so you can maintain that density for the next 10, 20, 30 years or whatever it's going to be.
Yeah. I mean, I have, again, I'm very transparent. I definitely have some weaker, and obviously I'm not going to use the terminology correctly, so correct me, but I had weaker follicles exactly where you're talking about for women. Exactly. Right here at the top of my head, I had very, very fine. I think it was
Right.
fine.
Miniaturized, right. So
Yeah.
those follicles miniaturize over time, right? So the follicles under the skin, that's what creates the hair that we see. The hair that we see is dead, the keratin. It's basically like your fingernail. But the
Yeah.
living and growing part of your scalp, the mini organ, the follicles, there's actually, 150,000 of them on your head when you're born. They turn on, grow a hair, and then they rest after several years for about 90 days, and then they turn on and grow again. And that cycle should repeat on and on and on over time. But as you lose hair, the follicles spend more time resting, not as much time growing, and they weaken. They grow a thinner, shorter, wispier hair with
Yes.
each successive cycle, so that eventually they become beyond repair. The good news is that we have a lot of therapies and treatments to be able to
Yes.
influence the follicle, and a lot of ways to influence, your nutrition status, your lifestyle, your gut microbiome, whatever it may be. Also looking at the health of the scalp, right? The microbiome of the skin, making sure there's no inflammation up there and there's no buildup or sebum, the oil glands and that are producing the sebum. We don't make sure they're not overactive, and make sure that you're not, that their scalp is exfoliating correctly. And if not, there's things that we can do to fix that too.
Right. So, for anyone who's listening, it's not necessarily about doing a hair transplant. There's so many other options if you're a candidate for those options. Because I know for me, when I had that done, you talked about, and I think it was somebody who was at your booth was showing me a special red light therapy device that actually works. And I
Oh yeah.
put on there that actually works, because one thing I will note is red light therapy is huge. Okay. We all know this. Everybody knows how important red light therapy is, biomodulation, whatever you want to call it. But there are different waves of light we need to strengthen the follicle that's already there. But when the follicle's dead, it's not going to work, right?
Correct. So there's this huge opportunity. If you know that your hair follicles are weakening and you're prone to female or male pattern hair loss, there's this huge window of time that you have to take advantage of early to help preserve and enhance the follicle function, make it more resilient to these, everything, all these things that we do to our hair, whether it's styling and color and braiding and extensions and all the other stuff that's going on in terms of our lifestyle and nutrition. We have to make the follicles more resilient. So you mentioned red light therapy, which has been a part of my practice since the 1990s. Actually, I set out to disprove red light therapy because I never heard of it in medical school. I had no idea.
Yeah.
But what I learned is that red light therapy has a very powerful effect on wound healing, and it has an extremely powerful effect on the metabolism of the hair follicle. And so, but of course, it's dose dependent. You want to be able to get the red light and the specific type of light, laser light, down into the skin of the scalp. It hits the mitochondria, which are the energy centers within the cells. It creates more ATP, which is the fuel that cells use. All of this has been worked out in the years since. We had no idea how this thing was working, but now we do. and we thank you to Dr. Michael Hamlin, who's had done the lion's share of the research in photobiomodulation and published it. So we know exactly how it modulates inflammation, and certain wavelengths are used for stroke victims and to increase blood
Yes.
flow to the brain, and to help, non-healing wounds in diabetics. And so when we use red light on the scalp, we're not using some, clunky, crappy device from Amazon.
Mm.
Sorry, that is not going to work all that well. Now, could it work? Well, maybe if you stack them one on top of another or something like that, maybe that would work. But the problem with some of these low quality devices is that they're so cumbersome to use. They're such low power that it's like you think you're going to go get a suntan by going outside for 5 minutes. No, you got to spend a little bit more time out there if you want that biologic effect to occur. And the same is true with the scalp. It's dose dependent. So the newest devices that we prescribe are medical grade. And what does that mean? It means that there's over 300 diodes, for example, in the Bauman turbo laser cap. It's completely portable. It's collapsible, so you could take it with you. It has a battery pack that's rechargeable, so you can do it hands-free. And it's got a short treatment time, just 5 minutes at night. And so that's our most popular laser that we prescribe and dispense through the office. It's Dave Asprey's favorite laser. I'm sure you
Mm.
know, the
Yeah.
father of biohacking. When he was married, his wife had one too. She loved it and borrowed it. He had to get another one
Yeah.
to get to her. But the point is that these devices now are very sophisticated, but they're going to be a little bit more expensive than what you see on the consumer market, just as you would maybe look at different skin creams or medications or things like that. Same is true with topical medications. Over the counter Rogaine or minoxidil is going to be kind of greasy and gooey and weak. It doesn't penetrate all that well. And a prescription version like 82M or something like that, that formula is going to be a lot more user friendly, easier to use, more gentle to the skin, more powerful at the follicle, and not leave any kind of residue that's nasty or annoying. So there's medical grade, and then there's like the regular stuff that's down there too.
Yes.
But red light is just a piece of the puzzle. If you love non-chemical treatments, well, we combine red light with regenerative medicine technology, like you saw at the conference. We have transepidermal delivery of growth factors and peptides. We have injectable treatments like platelet-rich plasma
Yeah,
and nutritional supplementation, things like
I
that.
was going to ask you about that because PRP is becoming more and more known for hair. I've actually done PRP. I did this and everybody told me it wouldn't last, and it's been 6 years, and I not in my hair. I did it on an Achilles chronic Achilles tendonitis, and I was told it wouldn't last, but it's 6 years and it's still going strong. So with PRP for the hair, how does that work? Because we know there's growth factors in PRP.
Sure. So for many, many years, we knew that the growth factors and cytokines and the information contained within platelets is utilized by the body to trigger wound healing and rejuvenation. I mean, that's what happens if you cut yourself with a paper clip or
Yeah.
something like that. You get a paper cut, platelets rush in, the blood gets clotted, and then all of a sudden tissue regeneration and repair occurs, right? And so that's the effect of platelets. And when we use platelet-rich plasma, the idea is to take a sample of blood and to centrifuge it to separate the formed components using G-force, literally a centrifugation process. Get rid of the red blood cells, get all the platelets, concentrate them, and then re-inject them into the area of concern. So when you use PRP on your Achilles tendon, hopefully it regenerated and rejuvenated the tendon and repaired it. And that can be a permanent response. On the scalp, because the follicles are highly metabolic and they're cycling on and off over the course of time, usually, and years ago, we used a series of platelet-rich plasma treatments to affect the change. But today, we've learned that if you use 10 to 12 billion platelets with a biological scaffold, a single treatment can last 10 to 14 months. And so that's our traditional PRP that we've done over 12,000 times over the past 18 years, using a very, very high dose of platelets in 7.5 cc's, 7.5 cc's of injectable platelet-rich plasma to get the results that we want in terms of hair growth. So that's an in-office treatment. It doesn't take much time, less than an hour or so. And there's no recovery, no downtime. And it gives a boost from the follicles that are still alive, the ones that are not dead, to
Okay.
grow thicker and stronger and better for about a year.
That's what I was going to ask. So maybe we should cover that off, because there's a big difference if you just have thinning hair but the follicle is still alive versus completely gone and you don't have any hair there,
Correct.
right? So maybe we should
Correct.
talk about what are the options. Okay, we talked about PRP, we talked about the red light, we talked about nutrients. All of those things can affect those follicles that are still alive, but what if they're gone?
Correct. Correct. So, I mean, look, there are still some other things that you could employ on the medication side of things,
Oh,
and
yeah.
there's more aggressive,
Oh,
regenerative treatments that could be used as well.
can we
So you
finish?
were
Let's
thinking,
finish that. Finish that first.
yeah,
Because you know what? People know Rogaine too, right? You mentioned Rogaine, but then you
right,
mentioned that there's more of a therapeutic grade side to Rogaine.
yeah.
So let's finish
I mean,
that.
look,
That makes
Rogaine,
sense.
yeah, Rogaine is a hair growth drug. It was FDA approved like 30 or 40 years ago. Originally, it was a blood pressure medication, and they noticed that those people on super high dosages of that would lower their blood pressure, but they also growing hair like all over the place on their arms and stuff. And that's how it became a baldness drug. And so that's how we got Rogaine. But over the years, they never changed the formulation, so it still is over the counter, greasy, gooey, doesn't penetrate all that well. But when we use a prescription version of minoxidil, we can do a few different things to it. So minoxidil is the active drug that works to grow the hair. It's an anagen promoting agent, which means it turns the follicles on and keeps them growing for an extended period of time. So if you have a weakening effect, the minoxidil will counteract that
Can
in a
I
good way.
can I ask you a question?
Yeah,
You said it's an androgen reducing.
no, anagen. Anagen is the
Oh,
growth
okay.
cycle of the hair follicle.
Okay, good. I'm glad because I'm like, did you say androgen reducing? I don't know if any
Well,
guy wants
we're
that.
gonna get Yeah, I mean, Sandy, we're going to get to the anti-androgen therapies. There's another
Okay,
medication for that. But
okay,
minoxidil has nothing to do with your hormones.
okay.
Minoxidil has everything to do with stimulating the follicle and increasing blood flow, and that's what it's designed to do. So today you can get the over-the-counter version, or you can get a prescription like Formula 82M, which is a powerful prescription version of minoxidil. That's our most powerful minoxidil topical, actually, and it's been used for almost 20 years and hundreds of thousands of prescriptions here in North America, both in Canada and the US. It is available.
The
And
side
then we
effects?
now, well, so on the scalp, when you ever use a topical, it could cause irritation, but obviously a lot less than if you're using the over the counter version. It's going to have a much better effect because it's going to penetrate better. And if you did have a side effect like irritation, it's usually dose dependent. So you just decrease the amount.
Okay.
And it's the prescription versions have some anti-inflammatory component to it. It makes it absorb a little bit quicker with tretinoin in there. So there's a few different things that are like magical that we combine together.
Cool.
The other thing that's really interesting over the past year or so is that in the general public, the public has become more aware of oral microdose minoxidil. And so for years, a decade or more, we've been using oral minoxidil for our patients who couldn't tolerate the topicals. And we use a small dose that doesn't affect the blood pressure. And we start very low and go slow if we're going to ramp it up and figure out what dose would be workable. But that's a very powerful hair growth drug that a lot of people are on. I'm on it as well.
Oh,
And usually a
cool.
microdose does not have any blood pressure side effects like headaches or dizziness. But
Okay.
that is something that could happen with the oral version of minoxidil. So a lot of patients are getting that prescribed. And again, we also use a compounded version of that because I want good quality. I don't
Yes.
want you to go down to your, local, garden variety pharmacy and get some, garbage generic that
Yeah.
they're filling. So the other medication that's very popular, primarily for men, is finasteride. Finasteride was FDA approved as Propecia, as the second
Yeah.
FDA approved
I've
drug.
heard
That's
of
an
that.
oral anti-androgen that blocks the formation of DHT in the body. It inhibits the formation of DHT, to be accurate. And as you lower the DHT levels in men, you then therefore protect the hair follicles. So it's a pretty powerful drug. 90% of guys get a positive effect from that. 2 out of 3 get a regrowth effect to some degree. And in postmenopausal women, we can use it as well, both topically and orally. So the caution is that finasteride in men, sometimes 2% of the time, can create a mild and temporary decrease of libido and also mild and temporary erectile dysfunction.
Yeah.
So some people are sensitive to it. In women, we don't have any reported side effects, but we don't want to use it in women of childbearing age. because it can affect the DHT levels in a developing male fetus, which is not good. So we don't want
Okay.
that.
Okay. Good to
So
know. That's
postmenopausal hysterectomy, no problem. We can use finasteride in women off-label. So that's not an FDA approved use, but it is an off-label use that we use routinely to also help women who have some thinning hair.
okay. That's the one I was talking about that reduces some of that. You can have that effect of reducing some of the androgens, right?
Right. So it's an anti-androgen effect. So it's going to reduce the DHT. Now we can use finasteride orally, as I mentioned. We can also put that into the topical in
Oh,
conjunction with the minoxidil. So that's again what compounding pharmacy allows us to do is take an FDA-approved medication and use it in a different way to reduce side effects, but still get great efficacy. And topical finasteride has that ability for men, let's say, who don't want to try it orally or can't or have had trouble with it. They can use it topically, and that reduces the risk of systemic side effects like dramatically. Like it's extremely rare, virtually unheard of, to find someone who's sensitive to the topical finasteride.
okay. Good to know. Great. Is that all of the ones the options if you have the follicle?
Yeah, I mean, like I said, there's the regenerative treatments like PRP. Then there's also the TED, transepidermal delivery, which is an in-office treatment that requires only about a half an hour, no needles, no downtime, no blood draw. And that's where we use an ultrasonic delivery system to break the stratum corneum temporarily, which is the moisture barrier in the skin, to allow penetration of these larger molecules like the growth factors and the peptides. And that's a treatment that we were demoing at the conference.
Yeah, I
And so
tried that
that,
in a little
yeah,
area.
so right. So you felt the vibration of the scalp,
Yes.
right? But there was no
Yes.
pinching, no pain. It was very relaxing, I'm sure.
Yeah.
That we do in the office. We were one of the first to actually have that in North America. And it has not even launched in Europe and Asia yet. So we're really excited to be on the cusp of that technology and to be amongst the few doctors who have that and are qualified to prescribe that and perform that outside of the original research studies that were done. And the results have been fantastic, unbelievable in terms of regrowth that I've seen. But it's like, again, remember, I don't know if I told you this, but I learned last year that Bauman means farmer in German.
Oh,
So Bau is tree, man, guy. So tree guy is a farmer. And so if we're talking about the scalp, if the trees are all dead and gone, then we better start planting some more. But if the follicles are weak, that's where we want to energize them with all of those things that we just talked about.
okay. Very cool. I'm going to have to find those videos because I know people are going to want to actually see. Those are really useful because we can
Oh
talk
yeah.
about it. But when you, and I'm sure your social media has a lot of stuff too, and a lot of
Mhm.
resources where people can see. Okay. So let's say I come in and I have a lot of follicles that are just dead, gone,
Yeah.
nothing there.
So a lot of our women come in, sometimes they've had some previous cosmetic surgery, like a brow lift or facelift. Obviously, the hair doesn't grow back in the scar naturally, but if you implant hair into a scar, you can get it to grow. And the same is true for a healthy scalp. So areas that have receded, where the thinning has occurred, or even if you want a lower hairline that looks more youthful, looks more feminine, we transplant hair follicles literally as small as a single follicle, as little as one at a time, from the back of the scalp. There's no scalpel or stitches, any kind of that linear or strip harvesting anymore in my practice. We haven't done that in over 15 years. We
Oh,
harvest the individual hairs one at a time and implant them into the thinning and the balding area in an artistic way so as not to damage the existing hair. And those hairs will grow there relatively permanently.
so gone are the days because I remember seeing like the whole strip where okay, now this isn't this called the FUE method?
Yes, right. So the traditional method that you just mentioned, the strip harvest, is what we were all trained in back in the
Yeah.
1990s. And I believe, unfortunately, many surgeons still do the strip. They haven't learned or perfected the way that we have the FUE procedure, follicular unit extraction or follicular unit excision, however you'd like to call it. FUE is the minimally invasive style of hair transplants, and we don't have to do a scalpel or stitch harvesting anymore. And
Yeah.
so you're not left with this big gaping wound that needs to heal. You're not restricted in terms of activities. After 4 days, you could be back in the gym. Most patients don't need any pain medication after a day or so. You could, if you're a guy and you want to wear a short haircut, you can wear a buzz cut or a fade without any worry that there's a telltale scar back there. And for our women, we can actually harvest the follicles without changing the hairstyle, without shaving any area whatsoever if we need to.
Okay, so for let's talk about both scenarios. So what if you're a guy that doesn't have a ton of hair in the back left
Mhm.
to
Yeah.
harvest
So
from?
meaning that, did they have a previous surgery or some other kind of
No, I'm just
injury? Because
saying it's
most
like
guys have a lot of hair.
it's it's thin everywhere, but you guys can if there's hair there, you can harvest that?
Right. Yeah. So, I mean, look, not every patient is a great candidate for a heroic hair restoration sequence, right? But if you look at patients like my dad, who had total baldness, he had a lot of hair around the sides and the back, he wore a hairpiece for decades. What we did is multiple sessions of transplantation, taking the hair from the sides and the back of his scalp a little bit at a time, and restored a full looking head of hair. So, does he have all the hair that he had when he was a teenager? No, of course not. But he has enough to look like he has coverage. And that's the point. So that's the idea with extensive hair loss. When you have a supply and demand problem, sometimes it's not feasible to harvest everything that we can out from the back of the scalp. And we have to go to alternative sources of donor, like beard harvesting for men. And
Oh,
so,
very cool.
in fact, we've done a lot of these cases. Not a week goes by in the practice here at Bauman Medical where we're not doing some kind of beard harvesting, sometimes exclusively for a patient who that's the only hair they have left now. Sometimes it's in conjunction with transplantation if we know they're running low on donor supply in the scalp, but it's done carefully because we don't want to put these thicker beard follicles that are coarser or have a different color in the hairline or anything like that. We pepper them in between as filler to increase density as we go further back away from the hairline.
That is so cool because, you see a lot of men who will have hair loss, a lot of hair loss, but they've got these beautiful beards still. That makes a lot
Yeah.
of sense.
Yeah,
Now,
beard is a great location to harvest from. I mean, we can also do body hair, but there's also other issues. If we go to the chest or the belly or the arms or the legs, the hair spends less time growing, so you get a shorter hair length, whereas beard,
right.
you can get a very long hair length typically.
Yes. So if I went, let's say I wanted to go in and get some hair replacement in and around where a lot of women have
Mhm.
thinning,
Yeah.
you would take from the back and you wouldn't even notice?
Correct. So, remember I said earlier that you can lose half your hair and it would look exactly the same. Women need less than 5 or 10% of the available donor supply usually to fill up the frontal zone. So it's a very, very small, let's say, withdrawal from the donor bank uh, in those areas to give to the frontal area if we need to create the coverage.
Yeah.
So, and it's even smaller if we need to do something like eyebrows or eyelashes or sideburns or something like that. But typically, let's just talk numbers of grafts for a moment. The frontal zone for most women, maybe 1,400, 1,600 grafts. And that is just a small fraction of what's actually available around the sides and the back of the scalp.
Yeah, that makes sense. I mean, because here's the thing.
Mhm.
Sometimes, Alan, I wonder because it's a big trend right now for women to get those oh God. I know
Extensions.
yes. I was gonna say weave, and that's totally not the right word for it. I but they get these like tapes and all this kind of stuff, and then over time, doesn't that do way more damage?
Oh, yeah. So what you're talking about is hair extensions, and there's no safe hair extension.
Okay.
Hair extensions are miraculous. They look amazing. I mean,
They
they
do.
use it in Hollywood all the time. If you're going to, a high profile event, you're going to a special event, a wedding, something like that. You want an amazing head of hair in one day, boom, you've got Hollywood hair. But the problem is that the hair follicle, when you put extra tension or pulling on the follicle over time on the extra weight on that hair, it can create damage at the level of the follicle. And so women who wear hair extensions repeatedly, even if they're rotated around, eventually they're going to have hair loss in, unfortunately, the best area that they have available,
Right.
or transplantation. So it can be a really devastating problem if you're losing hair in the front and then you've worn hair extensions in the back for a decade. You become less of a good candidate for transplants. But the good news is that if you're going to wear hair extensions, there's a lot of things you can do to make those follicles more resilient to that traction alopecia, which occurs with tight braids. It occurs with the wigs or weaves that a lot of women wear, especially ethnic populations, are pulling their hair, attaching with glue, as well as wearing extensions around the sides and the back, whether they've been taped in, glued in, beaded. There's a gazillion ways to put extensions on your hair, and none of them are healthy, unfortunately. None of them are 100% healthy. Some of them are better than others, because the more it's like time under tension, right? Like when you're doing an exercise and you're holding the weight with your muscles, it puts extra tension on the muscles and creates more tear and hopefully more growth of lean muscle mass. Well, if you put tension on that hair follicle for an extended period of time and you don't let up on it, it's going to damage the follicle permanently.
Okay. So, and the other thing I want to say is that the cost, it's so expensive when you're constantly getting new extensions and new hair. And I just know it's a lot of money too. So it's almost like, well, there are other ways you can have beautiful hair. And in the end, it's probably not going to be a massive cost differential when you add up the amount of money you have to spend to get them retaped, and then you have to buy new hair. Anyway, I'm just saying, just totally my opinion here.
No, I mean, look, people spend a lot on hair extensions and wigs and weaves and things like that, and maybe doing a lot of damage to their existing hair. And maybe some of that beauty budget might be better dedicated to protecting the existing hair at the same time, at least some consideration to it. I mean, I love my bio hair. I don't want to wear a hairpiece. My dad wore a hairpiece for 20 years before he had his hair transplanted back. And our women are the same. But, look, if you need a hair system, we do that too. We do cranial prosthetics that are medical grade, that are built in
Oh,
a factory in Bologna, Italy, based on a 3D scan of your scalp. And then an incredible team of artisans in Bologna are going to create a beautiful hair system in 12 weeks using 250 man hours of work from 1 billion hairs that they have in their hair library. And that could be an instant, Hollywood head of hair. And we can do that for men and for women. I've done that pro bono for women who have had injuries or trauma, like a childhood burn, a kitchen fire.
wow.
We've done that, for injured military veterans who have lost their hair and scalp damage from being shot at or blown up in Afghanistan and in the Far East. So sometimes we need to use a scalp prosthesis, to get the job done. And those prosthetics are amazing and incredible. And, they stay on for weeks on end, and you can go swimming and skydiving and shampooing and all of that stuff,
Yeah, I think I've
with
seen
those
that.
cranial prosthetics.
Yeah, I think I've seen that. There's like a newer thing where people are, just doing a little piece and they kind of glue it on, right? Is that what you're referring to?
So, I mean, look, there's a lot of different types of hair pieces out
Yeah.
there. There are disposable ones. There's ones from China and the Far East, and then there's these beautiful ones from Italy, which are medical grade. The medical grade hair systems are obviously much different. That's the upper level, the Ferrari, if you will, of hair systems, because they're so beautiful and they use unprocessed human hair, and they're customized specifically to the shape of your scalp using a polymeric base, which is a flexible base that gets attached to your skin. So whether you need it temporarily because you have chemotherapy going on or something, God forbid, like that, or you've had a burn or an injury, this is a lifeboat that we're happy to provide to patients if they need it or want it. And we have a lot of actors and politicians who use those kinds of hair systems as well. Of course, if they can't undergo those other types of treatments that we spent so much time talking about, like transplants.
Hmm. Okay. Let's say I am only 25 years old and I'm
Mhm.
a guy, because I think it starts a lot of times in quite young, like young men. What
Yeah.
is the first thing you would suggest for a 25-year-old who is noticing that their hair is starting to thin?
Yeah. So 20% of guys in their 20s have visible signs of hair loss. It's a huge number. And
Yeah.
unfortunately, it can be very distressing because you're at the bar on a Friday night with your friends and you're the only guy with male pattern baldness and you look 10 years older than your friends do. That's not cool. You're in the boardroom and you've got this receding hairline, not good. So it can be very devastating for a guy with early male pattern hair loss. They may be locked into wearing a baseball hat wherever they go, and that's not
Yeah.
so good for social situations either. You're not going to the wedding or a fancy dinner with a nice, for a nice night out wearing a baseball cap. That's not going to fly.
Right.
So you have to get an early diagnosis and you have to get evaluated. So, I mean, I have guys who are graduating high school with a big bald spot, and it's awful.
Mm.
Thankfully, that's not the norm. Usually it's just a little bit of thinning, a little bit of recession, and we have time to stop the loss. So we're going to inventory the situation. We're going to look at your medical history. We're going to look at your lifestyle factors, make sure you're not having this toxic lifestyle. And, a lot of these kids are college students or starting out in their careers and they're burning the midnight oil. Literally, they got not much sleep going on. And not such good nutritional status. So we need to kind of, get our hands on all that and at least identify what's going on. And then should they be on medications or not? That's very a personal decision. Should a guy be on finasteride early? Well, we prescribe a lot of finasteride very early. Why? Because it's powerful. And in 98% of patients, there's no side effects. And
Mm.
in 90% of the time, we get a good result. But that might not be for everybody. So let's talk about transepidermal delivery, PRP, which is non-chemical. Let's use red light therapy. Let's get you to cleanse the scalp properly with the right hair care products. Let's make sure there's no itching or inflammation or dandruff or seborrheic dermatitis or other scalp conditions that could be identified. So it all starts with that conversation and the visit, which can happen virtually. And so 50% of all of my patients start just like we're talking today on Zoom. We're doing a virtual consultation all day long with patients in the initial stages, getting that inventory of their situation, looking at their hair and scalp from a distance, obviously, but also getting an idea of what their level of concern is and what they'd like to do about it. Now, maybe they might eventually need to come into the office for sure to get measured, and especially if they're going to get a treatment like a PRP or a TED, yeah, they'll be in the office for that. But let's get started like immediately. We can't waste another day because, as we say in the world of hair, time is follicles.
Mm.
Every day, every week that goes by, especially for a guy in his 20s, right after puberty, it can start going down. So
Yeah.
let's get on top of that and figure it out. I have a lot of second generation patients, right? Sons and daughters of my previous patients who are now in their 20s, who are in the practice, and we're protecting their hair. And they may never, ever need a hair transplant. And
Wow.
that's the cool thing about it. So I'm happy to treat those patients. We have a lot of them. In fact, probably 2/3 to 3/4 of my patients that come through the door today may never ever need a hair transplant, or at least not one for a long time. And that's because we're early in the prevention.
What do you think of oxidative damage or stress as a cause for hair loss?
Oh my gosh. Well, oxidative stress is terrible for just about everything skin related, not, and of course, the hair follicle.
Mm.
It can dysregulate the system of hair production, and it can also dysregulate the hair pigmentation. So we've all heard
Ah,
about these,
yes.
stressful situations where, all of a sudden you get a shed or you've gone gray overnight, it seems, all of a sudden this can happen. And there's a lot that happens with oxidative stress, and it can actually degrade the hair follicle. So we want to make sure that, again, we're taking a more holistic approach than ever before, and that's why I have that functional medicine department in the practice. That's why I have a scalp health trichologist, certified trichologist in the practice, and she has a team. So we're really hitting it from all inside, outside, all different angles to really take a complete effect. And that's why our patients look and feel great so quick, from treatments, is because we're really hitting it from all different angles. There's no one magic bullet. And any Instagram ad that tells you this is a magic vitamin for hair growth, you got to just swipe on, just keep scrolling,
Yeah.
because it's not magic, it's medicine. And that's really what we need to do. We need to take action early and take a multi-therapy approach. And it's not one size fits all.
Yeah.
I'm going to let you in on a really, really new modality, a new secret weapon that we have that's
Yay.
coming out. And, this is really probably the first podcasts that we've talked about this on. So you're super lucky. And I didn't tell
Cool.
you about it ahead of time, but I've developed a system because you probably know I wear an aura ring. I'm really keen on my sleep, and of course, the sleep wake cycle is really really important for a lot of different habits, right? So if you align your sleep wake cycle accordingly to your chronotype, which is how you're supposed to sleep, you'll perform better. Hopefully, stave off degradation of mental degradation. Keep your brain function good, keep your metabolism going well, decrease stress and things like that. But also good sleep wake habits then port over into good other habits. Like, for example, if you want to do treatments for hair loss, right? So if you're taking nutritional supplements in the morning and at night, it's a good time to do that at morning when you wake up and at bedtime. And if you're doing a topical medication, morning and night. If you're taking an oral medication, maybe it's one or the other. If you're using laser light, maybe it's right before bed, like I've done. And so I've learned that getting into a habit is really, really important to win the battle against hair loss. And so I've developed an app to help people basically synchronize their sleep cycles and to get into that habit, that habitual regimen, and also learn about hair loss and hair restoration. So the Hair Coach app is going to be released shortly. I'm going to send you eventually how people can download it. We're going to debut it at Dave's conference in Orlando
Oh,
over the
cool.
summer. And so I don't know when this is going to air, but if it's after that, then we'll get you the information, obviously, about that and how it works. But it's a really, really interesting way to be consistent, because consistency with treatments, anything, nutrition or otherwise, weight loss, you name it, you need to be consistent. So I'm really super excited to use this circadian cycle method for hair regrowth. And I
I
think it's
love it.
really going to be super exciting. Yeah,
I love it because we all know if you're in the wellness space, you know that everything revolves around that circadian rhythm, right? Maybe that's
for sure.
why, you know how we talk about epigenetics and you see these 20-something-year-olds who carry that genetic, they carry the genes,
Mhm.
and then, they talk about epigenetics. The gun is loaded, but what's the trigger? Well, how
Right.
many 20-year-olds do you know sleep perfectly and have all these great habits? They're out partying, they're out, right? So
Right.
maybe that's why you see it start to happen in their 20s. I love that,
Yeah.
Alan. That's so cool.
Yeah, I mean, I was one of those dysregulated sleep people
Me
from
too.
probably from my residency program. 140 hours a week in general surgery. I've never slept well since. I don't think. Kind of like almost like a military deployment, just from the sleep wake cycle. Obviously, not anything else. But I've worked really hard to organize my sleep, and at least to try to get better quality sleep, even if I can't get more of it. So more time on the mattress, so to speak.
Yeah.
But this, I think, this sleep, this chronobiology is really, really important, and the circadian method is going to be great for hair growth and excellent for our patients, and basically anybody who wants to kind of hack the system, even if they're doing treatments on their own with, like, let's say, a laser device. How do you get in the habit of doing it? Well, you need a little bit of a coach, and that's what this Hair Coach app is going to do.
I love that. That's amazing. Okay, I'm trying to think if there's anything we missed. We covered a lot, didn't we?
We covered a huge amount. I mean, we didn't spend a lot of time on eyebrows and eyelashes, which is a,
No.
a, a favorite of many women. And so, if you had thyroid issues or you've had a metabolic situation, you can lose the thickness and the strength of your eyebrows,
Yes.
or if you've overplucked them. And there's topical medications that can work a little bit, and of course, transplantation for those areas. And it's a very, very popular treatment for women as they continue to age and lose eyebrows. But remember that eyebrow transplantation, what is this? Comes with scissors. Why?
Um,
Why does it come with scissors?
oh gosh.
Comes with scissors because we use the follicles from the scalp and implant them into the brow, and they grow long. So you have to trim them, you have to groom them.
Oh, kind of like it's kind of like, you see those like 80-year-old men who have the really long eyebrows and
Yes.
ear hairs and they have to trim them up. That's kind of,
Yes.
oh,
Yes.
interesting.
Yes.
Interesting.
Yeah, I admit, even though I may look young, I have to trim my rogue eyebrows. But yes, but women can get their eyebrows transplanted, and it's a very popular requests in the practice, as well as hairline lowering. Women who never had any kind of hairline recession, but are born with a very high hairline, and they want something that looks more youthful in the mirror, and to present a more feminine look. That's a very common request. Oh,
Oh,
and then of course
interesting.
eyelashes. So eyelashes, right? We can transplant eyelashes. Those also come with scissors because they grow super long, and you're gonna have to trim them. And gosh, if you're in a nursing home and you're not doing your biohacking stuff, then someone's gonna have to trim them for you as you age. But eyelash transplantation also very popular. It's one of my specialties. I'm one of the only physicians that tackles eyelash transplantation. I've done it for over 20 years, so it's a very popular
Really?
thing, and also in the practice. Yeah,
Well, that's kind of cool because eyelash, what are they called? The
extensions.
Can you tell I don't do this stuff, Alan? Like I do a lot. I do a lot. Don't get me wrong, but I don't do hair or lash extensions.
Sure.
And I exactly had that issue because I have thyroid ongoing ups and
Yeah.
downs. And so I actually I had to do something about my eyebrows because of that. Because, it's
Mm,
one thing to be able to fill in with a pencil,
sure.
but if you are going to the beach or,
Mhm.
nobody wants to get out of the water
Yeah.
with like no eyebrows, right? So
Sure.
I like
So
that
did you
stuff.
do pigmentation?
I did. I did.
Yeah. So very common. A lot of our women come in. They've had micropigmentation
Yeah.
of their eyebrows, and it looks beautiful, and they love the shape, but they just want it to be a little bit more three-dimensional. So
Yes.
instead of having that flat, even the brush strokes are kind of flat looking. So
Totally.
adding just a teeny tiny bit of hair into those areas really can make a big difference, and that's what we do with the transplants.
You know what, that is a great idea because I do see obviously from a distance you can't tell,
Mhm.
but if you come close to
Right.
me you can tell, right, that there's no actual, well,
Exactly.
I mean, I have hair, it's just that it's not like it used to
Yeah.
be, put it that way.
Right. And that's very, very common. And that's what our women are seeing. And so, a lot of times we also see that shed happening from vaccination and COVID, and also stress and lack of sleep and the hormonal imbalances and all that. So we do test for all of that and ask about it, of course. Um, and even the weight loss situation can also affect the brows and the lashes. So, again, it's this holistic approach, dissecting down into what are the root causes, no pun intended,
Yeah.
of hair loss, or maybe intended, and figuring out what's going on. And that's why people should start, sooner rather than later if they're seeing a hair loss issue.
Okay. This has been such a great conversation. Where can everyone, I know you're in Boca Raton, the name is Bauman Medical, but where's the best place for someone to get started with you?
Yeah, the good news is that I've had BaumanMedical.com, Bauman medical.com, the website, for over 25 years, and I've written every single word on that website. There's thousands and thousands of pages and hundreds, if not 1,000 videos of all different topics that you can imagine related to hair loss. But the most important thing is to click get a consult. So start here is the button, I think, and schedule a consultation. It means that we can connect virtually through Zoom. So from your home or phone, you can talk to me about your hair loss situation, and we can start to dissect into what's going on and what are the factors that are influencing your hair, good, bad, or otherwise, what you're doing now that's working or not working, and then what's the long-term plan to really increase, your hair span, which is the amount of time that you get to live with an amazing, thick, beautiful head of hair. So we're all here to increase our lifespan. We want to live a little bit longer, but most importantly, health span, right? We want to decrease that last 10 years of whatever it is, what they call the residual decade, of poor quality. We want to make that best quality over that last decade, and that should include your hair. And so hair
Yes.
span is a big part of that. So BaumanMedical.com, click schedule a consult, or just ask me a question. If you have a question about your current regimen, go to BaumanMedical.com/ask, and you can just type in anything and I'll respond to you, and we can get started with just that simple question. Of course, I do present a number of different conferences, so stay tuned to all of the traditional social media channels. I'm on, Twitter, Facebook, LinkedIn, TikTok, all the rest, as you can imagine. and we're always updating where I'm going to be and where I will be speaking and so forth. But Bauman Medical is located in Florida, but we treat patients from all over the world.
That's amazing. You're amazing, Alan. So nice to connect. Thank you so much.
Great to be with you, Sandy. This is excellent. Hopefully, I'll see you at the next conference. And
Yes.
thank you for this great opportunity to talk about hair to your listeners and followers. I hope they enjoy it. And just let them know that I'm here to answer any questions they might have about hair loss and make sure that their hair, looks good and feels great.
Thank you, Alan. Okay, I
My
pressed
pleasure.
stop. That was really good.